You know how it is when you grow up and everybody tells you you're like your grandmother? And in my case, it was that I had the same bow legs like my grandmother. And very early on, already in my 20s, I had my first surgeries on my knees. The main weight of my body was on the inside of my knee, which caused a lot of rupture.
And we have in the MRI pictures that the cartilage is deteriorated on the medial compartment, and that's compared with the axis.
I'm not ready for new joint replacement just yet. I'm too young. I'm active. I play tennis. I ski. I want to keep living that active life.
At all, she's active and she wants to avoid endoprosthesis. We see a low-graded, something about grade 2 varus deformation on the medial compartment combined with a cartilage defect, but the cartilage defect is only located on the femur condyle medially and not on the tibia head. The meniscus is intact, so the biomechanical properties with ligaments and everything on that is intact. So for that reason, this is a good joint for a treatment for correction of axis, a very robust and very standardized procedure. And for that reason, it allowed an early activation of patient, what we need for the people when we restore cartilage, for example.
So in January this year, I did my first knee and I had surgery, stayed in the clinic for about a week. First day, I was back up on crutches and I was walking around, and it felt fantastic. For the first time in years, I was without pain, even though I just came out of surgery. I am now 6 months later doing my right knee, and I can say I'm really looking forward to it, and I am not afraid. It was not a painful procedure the first time, and I'm now starting to stand straight and not be like my grandmother, bow-legged anymore. And I know I will be joint replacement candidate one time in my life, but not in the next 10 to 15 years.